Thank you, Dr. Archer. Thank you, Joyce. I appreciate the introduction. Today, my topic is attention deficit hyperactivity disorder. I'm going to refer to it as ADHD. That's the acronym. So from here on out, that's attention deficit hyperactivity disorder. What I'm going to tell you about is a working definition for this disorder. I'm going to give you some symptoms that are commonly seen with it. How do we diagnose it, and how is the diagnosis obtained? The effects of ADHD on the children and adolescents who have it. Treatments and interventions for this condition, as well as information on co-occurring disorders that overlap with ADHD. So there's a lot to cover. What I'd like to do first is recognize that some of the information I've used in this presentation is taken from the work of Dr. Russell Barkley. If you Google him, you'll find him on the internet under Russell Barkley, PhD. What is ADHD? That's the current term that we use for a specific developmental disorder with a childhood onset that persists throughout the lifetime of most individuals who are diagnosed with this. They have difficulties in three primary areas. That's hyperactivity, impulsivity, and inattention. ADHD is found in 5% of children. ADHD is found in boys 3 times more often than in girls. ADHD has a childhood onset, usually diagnosed between 6 and 13 years of age. ADHD has 70% of the people who are diagnosed with it will continue to meet the diagnostic criteria as adults. So only about 30% actually grow out of ADHD, which is something that a lot of people think is going to happen, but it's only going to happen